completed my nursing degree at what's now Vancouver Island University, and was the Malaspina College at the time. When I graduated, I went straight to Campbell River and worked there as a public health nurse and casual at the hospital. My husband graduated at the same time, and he was a forester, so we moved to Campbell River for his job. And with the forest industry the way it was on Vancouver Island, we really bounced around quite a bit as it declined more and more. And in September 2005, we moved from Vancouver Island to Chetwynd, and so that was a big adjustment. Family was excited because it's kind of an outdoors paradise. Home and community care, our community programs include home care nursing, home support, social work, rehab. We've got an assisted living building, so I'm the manager in charge of those programs in Fort St. John, Fort Nelson, and Hudson's Hope. And the primary healthcare integration role involves looking at our healthcare system and trying to figure out how to make that system work well together and wrap the care around the patient rather than having silos of care. So that's a big piece of work that I'm doing right now. The hardest part was moving away from family, but the people that I met at work in Chetwynd and in Fort St. John really were instrumental in filling in that gap. The people here are so friendly. And so although I was missing friends and family from back home, those spaces were filled up pretty quickly in Chetwynd and Fort St. John. We have 4 kids ranging from 14 to 10, so they're all pretty close together. But yeah, my spare time is spent doing family activities, as you can imagine. They all play hockey. My daughter's in Irish dance. One of my sons is in cadets. We do archery as well, so we're always busy. Basically, if somebody's looking for me after hours, they can find me at the rink. And it's fun. So we travel around the region. We go to other neighboring towns for hockey. It's a great family lifestyle. There are a lot of young families in Fort St. John. I really have enjoyed the sense of knowing a lot of people within the organization. So although I really enjoyed working for VHA, I didn't have the sense that I didn't know who our COO was, and I certainly didn't know who the CEO was. But I've met these people in Northern Health. We know each other. If I saw our CEO on the street, I'm sure that she would recognize me and say hello, and vice versa. And I don't think that in a larger health authority you would have that.